Now, here you can see a left lateral view of what your mink will look like. The top portion is similar to what you'll see when you've cleaned off most of the fat and the fascia. This is a ventral view of your mink. This is the sternomastoid. Cranial to the sternomastoid is the mandibular gland. Lateral to the sternomastoid, between the sternomastoid and the clavotrapezius, you will see your external jugular vein. As you're dissecting, at the interior portion, towards the medial edge of the sternomastoid, you will slowly remove the fascia and the fat from between the muscle layers. As you are doing that, you will want to cut along the caudal edge of the sternomastoid near the cranial portion of the clavodeltoid. Cut going laterally near the caudal border of the clavotrapezius, and also cut along the cranial portion of the sternomastoid and the clavotrapezius, being careful not to cut the external jugular vein, and also being careful not to cut the mandibular gland. This will allow you to reflect the sternomastoid and the clavotrapezius without having to cut the external jugular vein.
Hey, good.
Comic relief.
There we go.
Here, you can see your rhomboideus capitis. Underneath this is the splenius. Right here, ventral, you will see the clitomastoid. Here, you will see the levator scapulae ventralis. Above that, you can see your acromial trapezius. Dorsal to your levator scapulae ventralis, you can see your acromial trapezius. If you dissect along the cranial border of the acromial trapezius, and also along the ventral and caudal portions, this will allow you to reflect back the acromial trapezius, allowing you to see dorsally the atlantoscapularis. Dissecting the caudal portions of the levator scapulae ventralis and the caudal portions of the atlantoscapularis allows you to reflect these muscles back. Dorsal and caudally to the acromial trapezius, so you will see your spinal trapezius. If you dissect along the cranial portion of the spinal trapezius, this will allow you to reflect the muscle back. Reflection of this muscle allows you to view the Latissimus dorsi. In the process of your dissection, you will have to enter caudally underneath the forelimb and above the Latissimus dorsi, removing the fat and fascia in between. Upon removing the fat and fascia, you will have to cut the cranial portion of the Latissimus dorsi, of which there are several components. Cutting these components allows you to reflect the Latissimus dorsi, allowing you to see the serratus ventralis, and also to remove the fascia from in between the layers. Dorsal, you can see your atlantoscapularis, which is dorsal to the levator scapulae ventralis. Dorsal to the atlantoscapularis, you will see a band of muscle tissue running along the dorsal part of the spine. This is called the rhomboideus cervicis. Dorsal to that, closer to your scapula and your forelimb, you will see the rhomboideus thoracis. This is a small muscle and is easy to miss. Be sure not to break any of the rhomboideus cervicis while trying to remove the layers between the two. Alright, that should cover it.
Thank you.